Hello, I'm Rob Corbett, City Manager with the City of Pendleton with this week's update on the city's strategic plan. As a reminder, the city's goals are to reduce homelessness and its effects, improve the economic vitality of the community, improve public safety, and also improve the infrastructure and the maintenance here in the community. Last week, I met with the director of the Umatilla County Health Department to understand their role in providing resources for those suffering from mental health and addiction in Pendleton. And I learned their role is small beyond the work they do in prevention, which they focus primarily on young people. I then stopped in at Eastern Oregon Center for Independent Living. The acronym is EOCIL. They have two different locations here in town. My visit was to catch up on the services they provide here in Pendleton and to get feedback on how they're doing assisting people toward gaining freedom from homelessness and addiction. I learned they're hoping to open 4 apartments they recently renovated to assist people in rebuilding their lives. The apartments are supposed to be opening by the end of February. The homes will be supervised and the residents will be expected, as part of them living there, to be taking steps toward independent living. I understand they will be able to live there for 180 days. EOCIL provides harm reduction services, housing services, a food bank, and access to treatment for those who are wanting to get into addiction recovery. Consistent with other service providers, I'm hearing that access to treatment is difficult. When an addict is ready to go to treatment, they often have to wait several days or weeks before they can get in. By that time, the addict has had a change of heart often and is not interested in going to treatment. Wednesday, some of us from the city participated in the annual point in time count. This process attempts to identify the number of homeless people residing in our communities across the country. The group I was with walked downtown Pendleton from 6 to 8 o'clock at night, and we were able to identify around 10 people who said that they would be sleeping outside. There were 3 separate teams in Pendleton Wednesday night, and there were other teams that were in the community the next day. A final count often comes out months afterwards. After the pit count, I dropped into the warming shelter and they were full. And I think their capacity is 30. Last week, I also went to the Salvation Army during lunch and I visited with some of the guests there. I learned that most of the people that were eating lunch are not homeless, but local people who are in need. They are currently feeding around 150 meals a day. Many of the meals are delivered around town to shut-ins and elderly in need. They also have a food bank, they have church services, and they have Celebrate Recovery meetings there at the Salvation Army, which is a 12-step program. On Thursday, I was part of a meeting with a group of citizens interested in the indoor pool. If you'd like to connect with this group, please email me or call me at my office here. The number is 966-0221, and I will see if I can get you connected. In closing, I've told you my belief that the primary cause of the homeless problem in Oregon is addiction and mental illness. Of course, this isn't true in every case. Oregon has consistently failed to meet the needs of the mentally ill. Former State Representative Bob Jensen from Pendleton saw the future. Representative Jensen served in the legislature from 1997 to 2015. He recognized back then that Oregon was neglecting the mentally ill through underfunding, overcrowding, and weak accountability mechanisms. Today, Oregon ranks among the lowest in the nation in access to mental health treatment. Again, if you have any questions or comments for me, you can call me at City Hall at 541-966-0221. I will return your call. Thank you.